Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and we have a repeat guest today. We have Dr. Bertolini joining us, and we're going to be talking about spay and neuter. So thank you for joining us
Hey.
this morning.
Yeah, no, I love it. We'll just have to make almost like an annual or like seasonal get together.
Right. So for those that haven't heard you or met you before, you
Yeah.
are an ER vet at
hmm
Veg, right?
Yes. Yep. Veterinary emergency group, and since the last time we talked, we've grown. Like Veg has grown quite a bit. We have opened a lot more hospitals across the whole nation, which is amazing. So we can help more people and pets like when they need it most. But I have been at the same location in Katy, Texas, since October, since it opened. So October of 2021.
Oh, that's
So yeah.
awesome. Yeah,
hmm
I think we're getting more of the veg hospitals in Florida. I think I've
You
heard of
are.
like a few new ones coming to Florida, which is fantastic.
Yes, yes. Quite a few in Florida. Um, Quite a few more in Texas and California, like those big states. But
Mhm.
we're also breaching that gap in between East and West Coast, like
Right.
slowly. And it's really great just because we're in such a need of ER only hospitals. There's
Mhm.
also other things popping up like urgent care. And they kind of do, they're nice. They're kind of almost like they do the times that clinics close from like 4 to like 10 at night. They're
Uh-huh.
kind of that bridge the gap, but they do mostly outpatient stuff. So if there's something that goes in there that they're thinking needs hospitalization, a lot of them will send to us or to ER facilities. So those are popping up too, very similar to human ER, which is it's so interesting how everything's kind of moving that way. But
Mhm.
there's definitely a need for just ER hospitals, and the fact that we're filling that need is great, and we're definitely seeing a really positive response to that. So,
Yeah.
so yeah.
Yeah, that's awesome. I feel like unfortunately, it's like inevitable. You're gonna go to the ER with your dog once,
Yes.
whether they swallowed
hmm
something,
hmm
they're limping, they're throwing up,
hmm
whatever it might be. So,
Right.
yeah, I can think back to like 10 years ago when there really weren't that many like ERs. Like you maybe had to drive, depending on where you
Yes.
live.
Exactly.
Um,
Yeah.
so
hmm
yeah. So one of the topics I wanted to cover was spay and neuter because it's always going to be an important topic. It's always going to be a hot topic, and there's so many things to cover. And I'm sure you see different things with respect to being an ER vet, and so we'll kind of get into that too.
hmm
But let's just kind of start with the basics for people. So, at what age can dogs normally get spayed or neutered?
Yes. So dogs and cats can start getting spayed and neutered, which so there's a little bit of two answers to this question. So when I recommend that they get spayed and neutered is after 6, 7 months of age, usually before their first heat cycle. There is a little bit of difference between sometimes large dogs, like large breeds. They're nutritionalists versus oncologists, interestingly enough, kind of battle with it because nutritionalists think that bigger dogs need to go through one heat cycle because they just have still so much growing and maturing
Hmm.
um, to do. And I can understand that. But then oncologists see it as, well, if you spay your pet, specifically females, before their first heat, you drop the chances of them getting some sort of hormonal cancer, like mammary cancer, to 20%. So you drop it all the way down to 20. After their first heat, it's 50-50. After, if you spay them after their second heat, it doesn't matter how many heats they have after that. The chances don't change. So they recommend for our females to do it before their first heat, and also prevents, right, like unwanted pregnancy.
Hmm.
Dogs will hop fences whenever, like, it's crazy. Male dogs will just sense it for like miles away and just
Hmm.
somehow come and breed your dog when they're outside. Um, and then a couple other emergencies that we'll go over in a little bit as to that you want to avoid by spaying them earlier. And so
Hmm.
I recommend not sooner than 6 months, but before their first heat. Have there been a couple pets that have had an early heat? Yeah, they'll take you by surprise, but usually they don't go into their first heat, majority of dogs, until like 8 or 9 months into a year of age.
Hmm.
So I just
Right.
recommend before then. So let them grow, let their growth rate start to even out a little bit. Their biggest growth rate is up to like 6 months, and then they still growing, but it starts to slow down a little bit. So I want them to
Hmm.
keep those hormones for as long as they can, while also winning in regards to preventing like cancer and unwanted things.
Hmm.
And then I do say too, a lot of shelters will spay them earlier, shelters and rescues and things, because they're required by law to only adopt out sterilized pets because
Hmm.
of our unwanted, terrible high stray population. And so some of those pets will get spayed or neutered young, like 3 months, 4 months of age. And majority of the time it turns out fine, but I want them to have their hormones longer than that. So I
Right.
usually recommend like after 6, 7 months, like let's get it done around that time.
Yeah. So,
Hmm.
and I've heard of a few people waiting. They're like, well, I'm going to wait till my dog's 3 or 4. I'm going to wait till my dog's 5 or 6. And
Hmm.
quite frankly, I don't know any reasoning behind it. Can you think of any reason to wait until they're an adult?
Medically, absolutely not. Um,
Hmm.
a lot of it, people will say, I want them to go through heat, or they, I think it's almost people having empathy for their pet, like and not so much that their pet needs those reproductive organs. We hear it a lot with male dogs and like
Hmm.
neutering. Are they still going to be a boy or still going to be a man? And you're like, yes, they are, but they're not going to mark on anything. They're not going to get prostate cancer. They're not going to, get prostatitis and cause unwanted pregnancies. And so you're like, yes. And there's no, kind of like I was saying before, after that third heat cycle,
Hmm.
there's no difference between a third heat cycle and her 15th heat cycle.
Hmm.
All of them are dangerous after that, and all of them lead to a higher chance of them getting hormonal, like breast cancer or ovarian cancer. So no, there's really not any benefit. I say if you're not using it, lose it. Like if they're
Right.
not breeding, then they don't need it.
Hmm.
It's just kind of like waiting to become an issue.
Yeah. So you
Mhm.
mentioned the risk for waiting, one of them being cancer, which that's a huge risk. When we
Mhm.
got our 11-year-old Pomeranian, she was a rescue. She was the main mommy dog. So
Mhm.
she got spayed when she was 11, and a concern was like, let's check for tumors consistently, let's check for cancer consistently.
Mhm.
So
Mhm.
obviously cancer is a huge risk. Are there any
Mhm.
other big risks for waiting later in life to spay or neuter?
Yes. So starting with spay is probably there's I'll mention like a couple for both that are
Hmm.
emergency, like life altering things. So for spays, um, I see so many that come in for what's called pyometra. And pyometra is when pyo means pus, metra means uterus. So it's literally when their uterus becomes infected, and some of them are considered open where they're like draining out their vulva, and others are considered closed where they're not open and draining. And so there's no release valve. And essentially you have this big uterus like a water balloon full of bacteria in their abdomen. They get severely sick. They don't want to eat. They're vomiting. You essentially need emergency surgery to remove that uterus. before they either become septic or it ruptures. And then when it ruptures, it is hard to come back from that. And it's so hard to see pets that pass away from things like pyometra because it was avoidable, like
Mhm.
110%. And a lot of it is about education, about why they should spay their pets, or they just didn't know, or maybe it was a breeding dog at one point and they just didn't spay her afterwards. But I see that at the top of my list for
Mhm.
surgeries that we perform. And instead of a $200 to, depending on where you go, like if you're doing low
Mhm.
cost, like 100, $200 procedure, you have like a $5,000 procedure because
Oh,
it
wow.
becomes life-saving. And a lot of times they need IV antibiotics and hospitalization afterwards because they're so sick. And so that's something really tough that we see. And then we do see a lot of also with spays, like the mammary, people will come in because they had like a mammary cancer or something that
Mhm.
ruptured. And by that point, there's not a whole lot you can do. You can do a radical mastectomy, but that's also a lot because a lot of times these dogs are a little bit older. So,
Right.
can they handle that? And is it fortuitous to put them through
Mhm.
something like that? So, that's the biggest ones for females. And then for males, the longer that they have their testicles and their hormones, they get prostatitis and prostatic cancer just like men. Prostatitis can be treated, usually it's IV antibiotics, and pain medication, anti-inflammatories in time. But prostatic cancer, just like with humans, that is just one of the worst things. There's not really much you can do. And it's much far less likely for them to get prostatic cancer if they're neutered at a younger age.
Mhm.
And then the other thing we see is what's called a perineal hernia, and it's a hernia that happens. So when they have their testicles, it actually weakens the hormones weakened some of the muscles around their like rectum.
Mhm.
And one day they can be doing something, running, something that causes higher like intra-abdominal pressure, and they can actually tear one of the walls on either or both side of their rectum. And the thing that happens is sometimes the bladder can come through it too. And then
Oh,
that
wow.
becomes an emergency thing. Like you need to like push that back in. You need to repair those hernias. And that becomes also like a ticking, like, is there anything through that hernia, intestines, bladder, colon? Like, what is it that could be going through there that we
Mhm.
have to remove as soon as possible? And that is
Mhm.
more of a specialty procedure. So we don't have all the instruments to perform that here at Veg, but it would require like a specialty surgeon most of the time. There are some primary care veterinarians who do that because they have the tools for it. We
Mhm.
just we just don't. And then lastly, with neuters, you'll see a lot of uh, perianal tumors. So they'll also get a lot of tumors and that will rupture around their anus.
Mhm.
And the only way to get get rid of it or treat it is to neuter. But sometimes you can't. There's not much more you can do. So a lot of it is just all of these things that you'll see, um, just preventable by just
Mhm.
neutering them
Right.
at a young age, and then you can avoid some of those situations.
Right. Yeah, I don't think
Hmm.
I knew of all of those different risks. I had heard
Yeah.
of cancer,
Hmm.
but I hadn't actually heard of the, like, after so many cycles, the risk is the risk. I
Yep.
I didn't realize I almost thought it was age correlated, so that's actually
Hmm.
really good information for people to
Yeah.
have.
Yeah, yeah.
So
The oncologist kind of like drove that home during school. They were like,
yeah.
third heat cycle, whether they're 2 or 3, by the time they have that heat cycle, it's the same risk as if they're 10.
Hmm.
And then you're like, well, shoot, like you can extend your dog's lifespan by just doing it earlier. So yeah.
Yeah.
Hmm.
So let's say you decide to have surgery. What
Hmm.
is some prep before surgery? And I'll tell you, it's been a long time since I've had to get one of my dogs spayed or neuter.
Hmm.
I don't remember really doing much prep other than, maybe just making sure they had a space away from one of the other dogs,
Yeah,
and
yeah.
just having some bedding. But, I mean, other than that,
Mhm.
can you think of any other, like, prep you should do before surgery?
Yeah, so usually. before the day of surgery or the morning of surgery, we just make sure that you fast them, very similar to humans. They'll be like, don't eat anything after 12 p.m. Like fast them so that they have an empty stomach. And then upon like coming home, the main thing is just trying to keep them calm and rested.
Hmm.
And so if you know that you have other pets that they like to play with in the house and it's going to be hard for them because it's going to be kind of hard to keep them calm, then it may be best if maybe those pets hang out with another friend one day, or you have for the dog that or animal that just had surgery, maybe we need to give them a little something that causes some mild sedation just so that they sleep.
Hmm.
Because we let people know that dogs are incredible. When they have a ovarian hysterectomy, which is what a spay is, and the next day, they're up eating, sometimes wanting to play, especially puppies. They're like these healing
Hmm.
machines. And even adult dogs would take just a couple more days. They're more sore. They don't bounce back, just like us. But humans have that done, and they're out for like weeks. They're like
Right.
cannot really move. And dogs are like, let's go play. So a lot of people have a hard time keeping them calm. But like
Hmm.
the next day or the day after that, once the soreness has started resolving. So the main thing is giving them, don't let them play too much. They can go outside, they can go on a quick walk, they can go potty, that kind of thing. But if they're going to get rambunctious, jump up and off of things, run around, we don't want that because we need that body wall to heal.
Right.
Is the main thing usually about for like a week or so. We're like,
Hmm.
try and keep them calm as best as you can, and
Yeah.
then keep that dang e-collar on.
And no one does. No one, they're like, they're
No.
not going to touch their stitches.
Yeah,
They're
and
not
I
going to
promise
bother
you they
them.
are. It's like babies not wearing the mittens when they're like scratching at their face.
Yeah.
Like they're gonna do it. They just don't
Right.
know any different. It's not like they're like, I shouldn't do this because, it's gonna cause it to get infected or need to be resutured or come apart, whatever. They're just like, it's itchy and it feels weird and I'm just looking at it. And so
Hmm.
it's not about a whether they're good or bad. It's just they don't know.
Right.
So I was like, keep that e-collar on. You don't want to come see us. Like, you don't want me to have to redo something, or you don't want me to have to, like have to do a repair that's more than like the surgery. It's just, I just told them,
Right.
just leave it on. I know it's annoying. I know they're banging it into your shins. Like, I know it's so annoying, but just stay strong for the better good. Just give it a couple more
Hmm.
days.
Yeah.
Yeah.
So that kind of gets into like different complications from that aftercare. So one of
Hmm.
them, of course, being them like biting or ripping their stitches. So
Hmm.
I'm sure y'all see it every now and again.
Hmm.
And so a dog comes in, they're busted open. Is
Hmm.
it as easy as just like stitching them back up, or is there a little bit more to it?
There's a little bit more to it, and sometimes it depends. If sometimes they come in and they've like licked or chewed at it so much or it's infected, like we need to do usually a culture. Like we have to be like, okay, what's growing in here now? So we'll have to do a culture, start them on antibiotic therapy until we get that culture back. But a lot of times, like we have to make sure that they didn't get to the body wall. So there's a couple layers that you go through. You have skin, you have layers under the skin, and then you have your body wall, which is what everyone's like our abs and things like that are. And so
Mhm.
we hope and pray they don't get to the body wall. Majority of the time, they're chewing and looking at like the skin sutures because as it's healing, it's itchy.
Mhm.
Um, and so we have to cut that out. We usually have to cut out fresh tissue around it, like make new margins, flush it, clean it. Sometimes we have to place a drain in it, depends on how
Oh,
much
wow.
damage they've done. Yeah. Other times we can just resuture, put them on antibiotics, send that culture out. So, like I was saying, that like 100, 200 to whatever $400 procedure that you had done has turned into, an extensive $800 whatever more repair,
Mhm.
because now we have to make sure that we are not trapping any bacteria in. We got all the dead tissue out. Like now it becomes like almost like an open wound abscess type situation instead of healing healthy skin.
Mhm.
Hmm.
And then kind of aside from that, let's say you keep the e-collar on, you keep them calm. Are there
Hmm.
any other complications you can think of to look out for? Like, I know I've heard of
Hmm.
different people saying like, "Oh, well, my dog drug his belly through the sand in
Hmm.
the backyard. It looks
Yeah.
dirty." Or
Hmm.
uh, it seems rare, but I guess sometimes maybe dogs will come home, they might be nauseous or throwing up. Like,
Yeah.
can you think of like any other kind of complications that come up that people should maybe look out for after the procedure?
Yeah, absolutely. So some of the more kind of, I guess I would say simple ones are actually like it's not super uncommon for them to go home and maybe be a little nauseous. Most of the time, we give an anti-nausea medication before surgery that stays on board for 12 hours because anesthesia does slow the GI tract a little bit and can cause nausea. So sometimes they may come home, or also they haven't eaten all day. And sometimes
Mhm.
if they haven't eaten all day, they feel nauseous because they have extra bile. And so sometimes they'll go home, they'll vomit, and then they'll feel better because they had
Mhm.
like just like nasty bile, and then they'll eat. Other pets may go home and not want to eat, but it's not super, I guess I would say, like major red flag if that happens. I usually
Mhm.
just say, hey, just give them a little time, give them overnight, see if in the morning they're a little bit more interested in eating. The anesthesia just might have made them a little queasy. So you definitely can see that, especially if they didn't get an anti-nausea medication before the surgery.
Mhm.
Um, just like with humans, some pets can have suture reactions. So there
Mhm.
are some people who are like followed everything to a T. They're on it. They're the customers and the owners that you like love. They do everything you say, but then the pet still has a reaction and on the of the sutures, and it still may need to be repaired. But a lot of the times it will resolve itself with anti-inflammatories and antibiotics. We usually don't have to automatically go back in there and like clean those out like we do the ones that have been licking or chewing, getting
Mhm.
an infection. It's just the body, as those sutures are breaking down, the body just doesn't like them. Is having
Right.
like people who are allergic to like latex or adhesive,
Mhm.
their body's just not a fan. And so they will eventually completely dissolve, and it may take a little bit of time, but it's a sterile thing happening and not so much a infected thing happening. Um, and I would say of one of the major things for both dog for neuter and spay. For neuter, they can get scrotal hematomas. If there wasn't what's called a scrotal ablation, and you don't always have to do a scrotal ablation, but if you do them young, you like never have to. So essentially,
Mhm.
when they're young, they don't have like a well-developed scrotum. And so it just, after you neuter them, it just tightens up and then it looks like there's basically like nothing there.
Mhm.
For our older pets, which is another thing that's harder for our older dogs to get neutered, um, if they do have a well-developed scrotum, that essentially can become just empty space because you're just removing the testicles out of it.
Mhm.
And it also tends to be more vascular. So even if everything went perfect in the surgery, it can become more oozy with like blood and fluid just
Mhm.
filling the space that was once empty. And it can become like really, really swollen and full of blood. And it looks
Mhm.
like they were never neutered, or it looks like a big balloon.
Okay.
A lot of times you can treat that with anti-inflammatories and honestly like bandaging. Like it almost looks like they have like a diaper because you're just trying to stop the bleeding, like just
Right.
provide hemostasis and then the body and some pressure, and the body will eventually just eat, get the blood away, and then it'll be fine. But for a lot of my older patients that have like a scrotum and we're doing a neuter, I recommend a scrotal ablation
Mhm.
because I don't want them to go through that. Like it,
Right.
and you're like, it's uncomfortable for them, usually not life threatening, but it is very startling to see, to wake up with your dog
Mhm.
as a huge red, like you're like, I just got you neutered and it looks like you have a basketball under there.
Right.
So, and then for females, the other thing to monitor for is making sure that they don't seem almost overly lethargic or weak. I expect them to
Mhm.
be tired. I expect them to still be able to get up, follow you around the house, like do some usual things. But one of the things that can happen is what's called not necessarily like a dropped pedicle, but if one of the sutures came undone on either ovary or the uterus, there's a lot of vessels that go to it.
Mhm.
And if a ligature or a suture comes undone, it can bleed. And so sometimes I honestly want to say it's rare
Mhm.
when you put together all the spays and neuters that are done, or all the spays that are done every day in the whole nation, like It's so rare for us to see
Right.
it, but it does happen. But it happens more commonly with our older pets because they
Yeah.
have more well-developed vasculature going to their uterus compared to our younger dogs. And
Hmm.
so we just tell people if it seems like their gums are getting a little pale, they're really lethargic, you need to bring them in right away because there could be a bleeding vessel that
Hmm.
slipped its ligature or something, and she's like bleeding into the abdomen instead of it all being tied off. So
Hmm.
I would say that's the biggest thing is with our female dogs in regards to like life threatening is
Hmm.
are her literally when you lift up her lip next to her teeth, are her gums pink or do they look like they're becoming pale? And is she
Hmm.
like breathing faster, really weak, dull, anything like that? If it is, bring it to the ER right away so they can assess with like an ultrasound if they're worried about any type of abdominal bleed. But
Okay.
like I said, it's just the vast amount of spays and neuters. There's so many more risks and rewards than there are risks in
Right.
regards to something that severe. So,
Yeah.
yeah, like, but that is one of the ones that we'll see in the ER from time to
Hmm.
time. Hmm.
Yeah. Well, thank you for sharing all of this
Yeah,
information. I think it'll be
yeah.
really helpful for everyone listening. Even if your pets are already spayed and neutered, maybe you know someone else that's on the fence who, oh, I'm
Hmm.
going to wait, or, oh, we'll see what happens in a few years. I think this
Hmm.
really just solidifies that the younger you can do it, the better.
Yes, yeah.
You
Like
know,
give them the time to develop and get their hormones. I totally understand that shelters are like we need to get them adopted and and we don't need more. Like the whole point of the shelter is to spay and neuter and get these stray pets like taken
right.
care of. Um, and but even those pets, like even the males and things like that, they grow up to be healthy dogs. The
Hmm.
females sometimes will have, as they get older, what's called like urinary incontinence. It's just because sometimes when removing the estrogen a little early can cause them to become like their urethra sphincter to come a little loose. So they'll like maybe pee on themselves at night or something like that. But it's usually when they're like older in
Hmm.
age.
Hmm.
Um, so I always tell people it's good to give them some time. Give them some time to like grow up if you can. Give them a little bit of time, but let's get rid of it before she has her first period, and let's get rid of his before he starts marking or humping or gets unwanted behavior or gets past that 1 year age where now we're like, okay, like we could start having more chances of them developing prostate issues in the
Hmm.
future. So,
Right.
so yeah. Hmm.
Well, thank you for sharing all of this information with us. We appreciate you being
Yeah,
on.
absolutely. I hope you have a great day.
Thank you. Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.